Hi everyone, today I will be teaching you how to assist your child if they're having difficulty producing the K or the G sound. I know this one is a little weird as far as K, but phonetically the K represents the hard K sound as well as the hard C sound. So words like cat, that is the K sound for speech therapy. Words like cat and carrot, even though they start with a C, it's a K when we're talking about the sound. So if your child is having a hard time producing the K sound or the G sound, this video will be helpful for you. So an example of a child who is having difficulty producing the K sound is if they can't say cat. Instead of saying cat, they may say tat. Instead of saying vacuum, it's a vacuum. Instead of saying book, it's booked. So then these strategies would help with your child if they're having a difficult time producing the K sound. The G sound is if your child is trying to say good and they say I'm doing good. Or if they're trying to say yogurt, it's yo-dirt. Or if they're trying to say frog, it's a fraud. So these strategies will help with a child who has difficulty with producing the K and the G sound. Both of these sounds are produced in the same type of a way. They're produced back in your throat. And so a lot of times what your child will want to do is to lift their tongue to try to produce the sound, because that's what's happening when they're making that K sound into a T sound and making that G sound into a D sound. To do tat, their tongue is tapping behind their front teeth. Tat. Instead of the sound coming from back in their throat. Cat. To do that G sound, instead of saying good, they're saying dud with their D, tapping their tongue behind their top teeth, dud, instead of back here, good. And so how I help them, initially what I always do is I have a hand mirror that I use with my students as they're sitting next to me. This gives them good visual feedback on what their mouth should be doing while they're producing the sound. So for the K and G sound, if it's really hard for the child to produce, a strategy that I've used is having them try to bend the tip of their tongue and keep it under their bottom teeth. So I'll say, to produce that, we're going to focus on the K sound. To produce that K sound, we're going to put our tongue behind our bottom teeth, and we are going to push the air from back here. So watch me. Make sure that the tip of your tongue doesn't come up, because their tongue is going to want to come up, because they've gotten into the pattern of producing their K sounds like T's. So they're going to want to go t, t, t. But you're going to want to either have them keep their finger on the tip of their tongue so it doesn't go up. Have them try to hold it down, or have them to try to place that tip of the tongue at the bottom of their teeth and hold it there so it's a sound and that it's coming back here. So that's some of the strategies that I use to get them to make the sound in isolation. Have them have that cat-like sound that's coming from back here so that they understand that the sound should be coming from back here and not produced up here. Once the child is able to do the g or the k sound from in isolation, and the only difference in those two sounds is one has voice and one doesn't have voice. So if you put your fingers on your throat and you try to produce that K sound, you won't feel any vibrations here. But if you put your hands on your throat and you produce the G sound, g, it will be vibrating. So one's voiced and one's voiceless. And the K is voiceless and the G is voiced. Once your child is able to produce the K or the G sound in isolation, after you've practiced that, and that might take a lot of practice for some students, be patient. 5 minutes a day of practicing how to produce those sounds in isolation with them and you, with the mirror. Make it fun. Incorporate a game. If they like Candyland or Uno or something like that, you want the task to be fun for them. Incorporate foods if you want to have them taste something after they do the sound appropriately. Do things like that so that they can be encouraged to continue having fun with making speech sounds with you outside of their sessions with their therapist. So after they're able to produce it at the in isolation, just by themselves, if your child is not being able to produce the K sound in the initial position, then we start with the syllables. So A, E, I, O, and U. You want to first have them produce K, 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 Ki, Ki, Kai, Ko, Ku, with trying to keep that tongue down. And you're going to want to do 3 repetitions of each. So let's try to do this first sound. This first sound or word sounds like this. K, A, K, A. And we're pushing it from back here. So K, A, K, A, K, A. Can you try that? K, A. And then you're going to want to incorporate a visual for them to blend the sound. K, A, K. Can you try that? And they may go K, A, Tay. And you'll go, oh, that was very good. I heard you make a good K sound initially, but then it turned into your old way and it went Tay. So let's see if we can make it blend into K. Let's try again. K, A. Keep that tongue down. K. Yay! Very good. You did a great job blending those two together. If your child is having difficulty with producing the K or G sound in the medial position, then you do your syllables for the medial position of them. So instead of them saying vacuum, they say vacuum. So then you do A-K, E-K, I-Ki. I-Ki. So A-K, E-Ki, I-Ki, O-Ko, and Uku. And you try those to see if they can produce them in the syllable level. A-K. You try that. A-K. E-Ki. E-Ki. Again, patience, patience, patience when trying to help a child to produce these sounds, because it can be very hard at first. But when you're practicing and practicing, just like sports and just like working out, the muscles get used to it. So the child will get used to producing the sound correctly, and it'll become automatic for them. But it needs to be, they need patience. You need patience in the beginning because it may be very hard for them. So make it fun. Don't have super long sessions of practicing this. Make it fun, keep it short, and be very encouraging. If your child is misproducing the K or the G sound at the end, so instead of saying book, they're saying but, then you do your syllables after they have it in isolation. Then that's ache, eek, ike, oak, and ook. And then you try those at least 3 times, get them to blend. Once they are able to do their syllables or produce the K sound and the G sound at the syllable level, then you get your word lists and you have them practice at the word level. So kite, candy, cat, cookie, all of those, having them produce those words and blend those words together with the K sound. Then you'll move on to sentences. Depending on the child's age, you either create the sentence for them or have them to create it. I like cats, and have them say it. I like cats. I like cats. And then once they have it at the sentence level, then it goes on to reading level if they're able to read, and then conversational level. Again, with the K and G sounds, be very, very supportive with them. Be very, very patient with them. If you have any questions on how to produce the K sound or the G sound, or if you have any comments that you'd like to leave, if this has helped you and your child to produce these sounds, leave them in the comment section below. Thank you so much for watching our video today. Like, subscribe, and share these videos, and have a great day. See you next time.